Dr. Harvey Passes, noted cosmetic dentist, author, international lecturer, and innovative pioneer who researched and developed the clinical applications for the Holmium dental laser, is your host for Tooth or Consequences, the fun and informative show that explores new breakthroughs in dentistry. By combining his background as an entertainer and his passion for dentistry, Tooth or Consequences is an original forum designed to bring you a wealth of information on innovative technology and techniques that makes today's dentistry more comfortable and patient-friendly than ever. Along the way, you'll meet the exciting and interesting people who are improving the way dentistry is done. The people responsible for bringing dentistry into the third millennium. So sit back and relax as Dr. Passes gives you the information and ammunition you need to help keep your teeth for a lifetime. For if you don't, it will surely be Tooth or Consequences.
Hi, I'm Dr. Harvey Passes, and welcome to Tooth or Consequences. Well, today's show is going, well, you know something, I can tell you all about it, but I think you're going to find it a lot more interesting when you see this about 2 or 3 minute clip, and then from there, come on back, because I know after you see this, it's absolutely just going to blow you away. So, be blown away, watch this clip right now, and then we'll come back and talk.
Oh, these kids pretty nice. John has a dental deformity, a pronounced underbite, and a crooked jaw. It's caused physical problems as well as some emotional scars. It must be very difficult.
Well, first of all, it's been intimidating for me to talk. Big overbite.
John grew up as a healthy and normal child, but around the age of 12, he noticed some changes to his mouth. He was very self-conscious of his deformity, and he withdrew from social situations, hiding his smile. John recently started college, but wasn't meeting new people and making friends. He said he bottled up his sense of humor. The physical problem made him avoid foods he had difficulty chewing, like pizza. The foods John could chew had to be carefully maneuvered around his mouth.
Have anything done.
Have you thought about some of the things you'll do that you don't do right now?
Smile more often, yeah, to people.
We went to the hospital the day of the operation, a day John thought would never come. How are you feeling right now? You're a few minutes away from going into surgery.
A little nervous. Waited too long already. Wanted to get it over with.
Okay. Finally, after years of waiting, after years of enduring pain, discomfort, inconvenience, and even ridicule, John is just moments away from the operation that he believes will change his life forever.
Okay, get a retractor up here.
The operation lasted more than 4 hours. Dr. Super moved John's upper jaw forward, his lower jaw back, and aligned them so they would no longer be crooked. Dr. Super said the operation went very well.
Sorry, hold this down. Hold this down. John will probably notice over a period of time a speech improvement, eating improvement, and hopefully emotionally he'll feel better over the next months and years.
We met with John several months after the operation. Comparing John's physical appearance before the surgery to how he looked after was dramatic. We also noticed a change in his confidence.
The operation has given me a big change. First of all, let's see, physically, I have a new appearance, and I like it now.
John can now eat any food he wants, and he can do something he avoided for so many years: smile. John realized that all this could not have happened without the help of Dr. Super.
Open, you are.
I would just like to thank them.
So, who is the magician who did this phenomenal service for this patient? I mean, this patient was absolutely able to go out into the world and function with incredible self-esteem. So, who's the magician? Well, the magician is Dr. Stuart Super. Dr. Super, Stuart,
Nice.
welcome to Tooth or Consequences.
Thank you.
I mean, it's absolutely fabulous when you see the results, the before and after of what you can do for people. It's just fabulous. Anyway, let me tell people who you are first, and this way people will get a chance to know you as I know you. Dr. Stuart Super is, well, let's go back. First, he's an oral maxillofacial surgeon. And that's a pretty long phrase for someone who does a lot of surgery all around the head area. and the jaws mostly. And let's just go back into his background. He went to New York University, and then from there, the Harvard School of Dental Medicine. Then from when he finished there, he went to the Mount Sinai Hospital and did his training in oral and maxillofacial surgery. From there, he went to England and France. Not vacationing, right? No, training. Okay, right, not vacationing. Good wines, though, right?
Great wine.
Great wines, okay.
Great wine.
So he trained in England and France for how many years?
2 years.
2 years. I wish I could have been there with you. Anyway, so for 2 years in England and France. Then he came back and he taught at the University of Pennsylvania School of Dental Medicine for how many years?
Almost 10 years.
Almost 10 years. Great institution.
Great.
And now he's at New York University College of Dentistry, where he is the co-founder and director of the Stuart and Tibby Super, that's you, Foundation for Dentofacial Deformities. So we gave you an awful lot to get to learn who this magician is here. First question.
Okay.
Dentofacial deformities. What is that?
It's a fancy name for
what?
Straightening your jaw.
Straightening your jaw.
Absolutely. I mean, people have a variety of problems of growth and development of their face, and sometimes the upper and lower jaw don't grow together quite right.
Right.
So that's basically what we do.
Okay. And the term, we use the term all the time, orthognathic surgery. Fancy word if you're playing Hang the Man or Scrabble.
Absolutely.
But what is, again, orthognathic surgery?
Well, it's straightening the jaw.
Same thing
Simple,
again.
simple phrase.
So ortho straight, gnathic jaw, so straightening the jaw. Okay, now, again, very interesting and very impressive when people see what we just saw. Question is, who would come to you for this? What kind of jaw deformities would you see so that you could make some magic on these people?
Okay, well, a variety of people are often sent to us with problems ranging from a gross underbite, much like we saw in the videotape,
right,
to people who have a deficient chin, maybe a very weak chin or an undeveloped jaw,
right,
or maybe they have a asymmetry or crookedness to their face. If you look at them straight, you know, one jaw's off to one side.
Okay.
Or they could have an underdevelopment of their upper jaw and nasal complex, or the nasal area is pushed
right around
back.
the nose, everything is pushed in and this comes out.
Exactly. Or they could have an overbite, where the upper teeth almost sticking out of the mouth, but they can't be straightened alone by orthodontics.
So let's hold the phone for a moment,
Okay.
because I think you have some slides.
Absolutely.
Okay, so I would love for the audience at home to see it. Sherry, could we take a look at those slides and tell us what we're looking at? If you check on the monitor here.
Okay.
Well, that's your foundation at New York University College of Dentistry, a not-for-profit organization that I know very well, having gone there. Next slide, please.
Okay,
What
now,
are we looking at?
this first individual is similar to the case we saw on the videotape.
Yes.
He's a person who grew up with a very gross underbite.
Okay.
It's an interesting story because Matthew even was turned down from the military because of his gross
Because of his bite.
He had
What
such a
what do they expect him to do, bite the enemy?
Well, you know, when you go into the Army, you have to have no handicap.
Right.
And they considered his bite so bad that they felt he had a handicapping problem.
Do we have a profile on him?
We have a profile, and we have some of his teeth.
See, that's more emphatic.
Now, he had an emotional problem, he had a physical problem, and a handicapping, what we call a handicapping bite. So let's look at the next
slide, please.
Next slide.
Wow.
And here you see the grossness or the distortion of the growth of the upper and lower jaw.
So the lower jaw, folks, is out forward, and the upper jaw appears to be pushed back inward.
Correct.
Okay, ahead.
So now, let's go to the next slide. You can see this from the front. Now you can see he would have trouble chewing and functioning very well because anytime he couldn't bite on his front teeth. There are certain foods he could have to avoid.
Right.
He'd have problems with a lot of his diet because of this bite.
Okay.
And he also has a speech problem.
It would have to.
He has to have a significant speech problem. I think we saw that in the videotape.
Yes, absolutely.
So now, this individual had to have orthodontics before the surgery because his teeth were not only malaligned, as we see on the picture, but if we were to move the jaw without orthodontics straightening the teeth a little bit, the jaws wouldn't fit properly.
Right. Next slide, please.
Next slide. Now here's Matthew right after surgery.
Look at this. He's got a reason to smile.
Now, interesting, Matthew came to me after